In our health alert tonight, 7 children have died due to a virus outbreak in New Jersey. 11 others are infected, and health officials say the adenovirus is to blame.
With reports of the polio-like illness from AFM striking children and now this adenovirus outbreak, it seems like illnesses and diseases are on the rise. So we brought in our chief health editor, Dr. Partha Nandi, to find out why this is happening. Doc?
So, Alan, lots of viruses and illnesses with scary names and alarming consequences are certainly circulating. Over the last 25 years, in fact, here in the U.S., there have been a dozen new diseases crop up. Now, there are several factors that play as to why this is happening. The sad reality is that we're seeing new infectious diseases. Some of this happens naturally in just a few minutes. So even the flu bug, as we know it, is capable of changing itself genetically. And our bodies don't recognize this change, so we don't defend against it, and we get sick. So other reasons are due to our behavior and changing lifestyles. More folks on the earth means what? More living areas, and we're moving into wilderness areas, which means we're closer to animals. And many new infectious diseases actually originate in animals. We're also urbanizing and living closer together, which makes it easy to pass bugs. And domestic and international mass transport allows us to move freely around the world, bringing infections and viruses anywhere sick people go.
So, Dr. Nandi, people are really concerned about this. What kind of questions can they ask their own health professional to have a peace of mind?
So, Glenn, as you know, I love helping people become their own health hero, and that's important because for you to take charge of your own health, and that includes becoming involved in your health care. So when you see your doctor, you can ask, first, what are my risks if I pick up an infectious disease? Steps can I take? Also, am I up to date on my vaccinations? Do I have a compromised immune system? That's really important to know because infectious disease can really hit those who are compromised in their immune system, and it hits them harder because the body can't defend itself against those illnesses.
All right, doctor, so for the parents who are watching, what sort of questions can we be asking our child's school?
As you know, I'm a parent and I can totally relate. So here's some questions I would ask. First, does the school discuss good hand washing practices with children and its staff? How often are materials and frequently touched surfaces cleaned and disinfected? How does the school prevent infections when possible? Important questions. Now, I know it's scary hearing outbreaks, but research shows that, guess what, that they appear to be declining per capita. And the good news is that improvements in prevention, along with early detection, control, and treatment are helping to lower how many people actually get infected. So all good news, but let's take some precautions to make sure that we don't, become victims to some of these infections.
You know, we drop our backpack when we come in from school, and then we wash our hands. It's what we do now, Dr. Nandi. And,
great practice.
Thank you so much.
All right,
if you have a question or a health concern for the good doctor, you can email him at drnandi@WXYZ.com or send it to us, Facebook or Twitter, and we'll get it right to him.